And we're certainly very excited to welcome the next two speakers. And the first speaker is Josefina Campos, and she coordinates the National Genomics and Bioinformatics for Pathogen Surveillance platform at the National Reference Lab in Argentina. And she is accompanied today by Marcelo Galas, who heads up antimicrobial resistance surveillance at the Pan American Health Organization. And we are very excited to listen to the work that they have been doing on looking at the harmonization of antimicrobial resistance data. So Josefina, I hand over to you now. Thank you.
Thanks very much. I will share my screen now. Okay, so we are going to explain how we are going to use the harmonization tool in Latin American surveillance networks. I will handle now the word to Marcelo Galas from PAHO, who is going to explain how we do AMR surveillance through the Relabra network. Marcelo, over to you.
Okay, thank you, Josefina. Thank you, the organizers, to invite me to share with you our activities at the Americas. Yeah, the following, please. Next. Yeah, okay. We are doing surveillance in the region to accomplish, to provide information to the different level, at local level, national level, regional level, and global level. The information that we collect used to be useful for all the levels. At local level, for inpatient care, empiric treatment, antimicrobial procurement at the facility, antimicrobial stewardship program, and also for prevention and control activities at the hospital. At national level, the information that we produce in the region inform decision maker or AMR intervention and guide the national action plan to the development, implementation, and evaluation. Inform technical guidelines, surveillance, clinical management, and treatment. And also inform updates to the essential medicine list in the country and give information about the moment that is needed to do some changes in the essential medicine list at national level. At regional level, the information permit us to evaluate trends in the region and to do alerts in the region, to prioritize regional strategies to control, and also to do advocacy and resource mobilization for the countries in the region. And at global level, also the information that we collect, GLASS, for example, permit to do global prioritization of activities at global level. Next, please. Okay, what we are doing now, yeah, the Relabra is our network, is the Latin American network of antimicrobial resistance surveillance. Starting in 1996, 20 countries are participating through the National Reference Lab. Relabra is a network of networks. Each country have their own network to produce results at national level. And we have data, aggregated data for selected pathogen drug combination that you have at the right part. We have at this moment 15 different type of microorganisms under surveillance in the region. In between 2000 and 2014, we have 750 laboratories that are collecting data, and we are near 3 million data at regional level. And we have now a platform that is pleased. I will show you a couple of slides with the information that you can find. It's open for the public. You can find about the surveillance of the Americas. In the last year, we start working in Relabra Plus. That is a different type of surveillance. We are changing the paradigm of surveillance, moving from aggruppated surveillance to patient-level surveillance. And we start with blood culture, and these are the right, you can see the means that you are surveillancing blood culture. And this pathogen include also Candida. Yeah, we have 13 countries participating in the patient-level surveillance. Until the moment, we have 3 countries that already share data with us. And we are working also to include Caribbean at the surveillance, because the 14 countries at the Caribbean don't have a established surveillance system. Next, please. Next, yeah. This is part of the visualization that you have. If you would like to go in depth, you can go to this link in the upper part of the slide, and you can see there the pathogen that we have under surveillance and all the results. And you can play in the platform with years, origin, pathogen, species, countries, etc., etc., etc. And you can see the evolution of the resistance, the trends in the resistance in the Americas. Yeah, it's a big platform. You can enter there and play with the data. For the next one. Next one, yeah. Regarding patient-level surveillance, that is our new initiative. We are doing bacteremia and candidemia. These are the data that we have until now, 76 hospitals belonging to 3 countries and 11,000 isolates approximately in bacteria, and also Candida, 3 countries and 30 hospitals, 340 episodes of candidemia. Yeah, we have the information at patient level in that case. The next one. Yeah, we are working also with new technologies. We have the capacity to do whole genome sequence in 12 from 19 countries in Latin America that you can see in green, and at the Caribbean we don't have any countries yet that is doing a whole genome sequence. These activities that we are doing in whole genome sequence is a joint activity, is a synergy in between PRELABRA and PulseNet Latin America and the Caribbean. Next one. We did a consultation in October last year, and we are working now in a roadmap to solve the problem that we have regarding whole genome sequence. The current situation at the region is that the application of whole genome sequence is just for a specific situation, not in general for AMR surveillance, and because we don't have money to do that. Management of whole genome sequence data on closed platform with decision makers. Then it means that the countries just share the data that they collect for whole genome sequence with their own authorities at national level. Data sharing is a big problem in the region, like in the rest of the world. Future needs that we identify in our activity in the consultation is that the countries need training, specifically in analysis and interpretation of results by informatics, and also mainly in application of the data for public health activities or measures. Standardized data analysis, standard workflow, reproducible results, regardless the platform that is used. Yeah, we have heterogeneity for this at this moment at the countries, and we are moving to have a standardized way to analyze. Then the activities that you are doing is very interesting for us. And regarding the challenge and opportunities, we have a lot of strengths, weakness, opportunities, and also threats. COVID is one of them. But one of the things that you are probably more interested is that the use of new molecular techniques in AMR surveillance is a strength in our countries and the region. And the last one, to give opportunity to Josefina to expose the part of PulseNet. We are working now in like transform data in actions. Yeah, this is what I'm doing now in the region. And one important part for us is the strengths of laboratory surveillance, including new technologies, specifically whole genome sequence and MALDI-TOF, mass spectrometry in the region. And nothing else to add. I would like to say thank you to the Caribbean Network and also Latin American Network. Josefina.
Thanks, Marcelo. So the other network we have in Latin America and the Caribbean is PulseNet. PulseNet was established in 2003 and is one of the 7 regional networks within PulseNet International. And one of the aims is to strengthen national and regional laboratory-based surveillance for foodborne pathogens, for early detection and investigation of outbreaks. And as Marcelo mentioned, we started working with whole genome sequence in 2013 in the Americas, especially in PulseNet, but we still aim to standardize a way to do genomic analysis. So far what we have is a lot of tools going around the different countries and the different national laboratories, reference national laboratories. So far we have many AMR gene detection tools, different output reports of detected AMR genes in a non-standardized or comparable formats. This is quite a challenge for Latin America and the Caribbean. We have a barrier in the comparison of results across tools, in the modularity of tools within the workflows, and of course in how to communicate these results among the national reference laboratories and also between the networks, Relabra and PulseNet, for example, where we have some, for example, regional projects together. So having that in mind is where Data Structure Working Group chaired by Emma Griffiths, who works in develop and promote data standards, started working in one tool that is hAMRonization, where data standard for bioinformatic detection AMR genes for genomics data is one of the aims of this tool. The idea is to use the genomic workflow with the different 14 tools that are the most used right now and generate a harmonized and a standardized AMR gene report so we can all the users, the different stage of the users can use and share data. hAMRonization provides these standardized field names for reporting AMR detection results, but also provides definition, guidance, and ontology identifier to validate these values, automatically converts the various outputs of 14 AMR gene detection tools to a standardized unified report. And this tool also supports the creation of summary reports across tools and datasets in a variety of formats. Tabular, JSON, interactive HTML that is viewable in a browser. And the most important things, especially for low and middle income countries, that is most of the Latin American and the Caribbean region, is that this specification and hAMRonization is open source and freely available. This is the GitHub to take a look for this hAMRonization. How are we using this in Latin America and in the Caribbean? So the idea is to have a pilot between the networks, Relabra and PulseNet Latin America and the Caribbean, to explore the utility for improving genomic-based AMR surveillance communication and data sharing among these national reference laboratories in the different countries and in between both networks. So all participants working with genomics in these networks will test hAMRonization with the different tools with a local data set, particularly Salmonella typhimurium with resistance and sensible genomes and Shigella sonnei. And these tools will support the creation of summary reports across these tools and data sets in these different formats, so we can all the countries share this data and evaluate what is useful for the networks. The idea is to have feedbacks from all the countries to evaluate the tool regarding the installation, the use, the useful information to interpret results. And this is not something something minor, because as Marcelo mentioned, in the networks, in both networks, we have different kind of actors, people that works in the clinical side, people that work in the genomic side, and we all need to communicate in an easy and shareable way to interpret this data and bring it back to the networks to use it, and specifically use it into our national surveillance systems. Oh, sorry, this is not here. So thank you all, specifically to the Data Structure Working Group, chaired by Emma Griffin, especially thanks to Finlay and Ines, and all the FAGE Consortium, especially all of you for listening, and the Bill and Melinda Gates Foundation for finance this This is part of the working group that's not possible without the contributions of all of them. I particularly want to thank, I have been enjoying very much being part of this working group and learning with all of these people. Many thanks.